Good morning, everybody. This is a day earlier than my usual message to y'all because tomorrow I am taking a leave day. So I figured I better go ahead and get this done today. Um, you know, we need to take care of ourselves. Y'all need to take care of yourselves too. You need breaks. There's a lot of stress going on, a lot of pressures. We understand that. I'm taking a little break. And hope the weather holds out. It's actually a little bit cooler. So this is a day earlier, and I hope everyone does have a good weekend that's going to be ahead of them. Not a whole lot to bring y'all up to date on. There's one thing that I want to follow up from last week about, and that is, I talked a little bit that we were beginning to change our model around testing. We're beginning to collect information, insurance information, from folks that are going through and having testing done, drive through, or at some of our Department of Health sponsored events, and even our Mobies as we get them up and going, so that we can begin to think for the long haul. We are really looking ahead and thinking that testing for this coronavirus is going to be around for a while. Don't anticipate it going away very soon, so we might as well hunker down and make the best of it. And making the best of it means in situations where we can charge for this, we're going to explore every possibilities. As a matter of fact, we are not only looking at the collection of insurance. That was Bailey this time, my dog that knocked my table scattywampus. We're not only looking at collecting insurance information, but we're thinking, and we're going to be changing our whole model. Uh, you know, our model has been that we would have testing done through three stations. One of the stations being to collect the registration and now the insurance information and to pass on to the people being tested other information around what to expect around the coronavirus and other health educational materials. That's going to remain in place, and like I said earlier, it's going to step up a notch and actually be collecting more information. Then our second station was a station in which we staffed nursing staff. Now, as we watched testing roll out throughout the state, this model of having nurses was not being adopted in any other settings. We liked it because there was a lot of questions around the coronavirus, especially in the beginning. Nurses were able to give clinical information and to help patients better understand what the needs were, what the choices were, how to avoid, what to do if a test came back positive. So we liked that model. And then, of course, the third station was the actual specimen collection itself, the lab techs doing the throat swabs or whatever needed to be achieved. We are beginning to back off from that model specifically by backing off on having to have the nurses at a second station. We are frankly finding that this is stretching our nursing staff too thin. They are already quite busy in just the act of following up with all those tests being done. We're doing between 1,000 and 1,200 tests a week, and that's a lot of work being done. We're going to not only be pulling back and having those nurses have to man that testing station, so to speak, but we're also going to be using other staff that can call and follow up with patients whose test results are negative. That doesn't necessarily have to be done by a clinician. We're helping develop some scripts and do some training for other staff that can fill this function and give the nursing staff some relief in this area. We're also going to do some changes in our whole follow-up protocol. We had a protocol, kind of our own guideline, where if a person had tested positive, our family support staff level 3 were doing follow-ups on a daily basis practically. I'm not quite sure exactly but that was pretty demanding. And a lot of times the people that had tested positive were asymptomatic. They were actually quite fine. And in some cases, even getting a little perturbed on why are we continuing to bother them. So we have also decided to back off on that with folks that are asymptomatic who have tested positive, but really are okay. They don't need constant follow up. So we are beginning to change that model too. We are also going to look at another model or kind of changing our model in another way, and that is we have learned a lot of other FQHCs are figuring out how to do this type of testing and to do so and at the same time provide added value to the patient, added value to the person, literally bringing them a provider encounter, looking at it as an opportunity to uh, get access to patients who otherwise weren't coming into our buildings. So we're going to be looking at seeing if we can't do some of that model changing that we've seen be successful in other FQHC community health center settings, bringing more providers to our testing events or opportunities. We don't know exactly what that's going to look like, but we are all about innovation and exploring new ways. We are not set in stone. We don't believe that our way is the only way. And when we see another way that can look better and be of benefit, then we're gonna jump on it and do what it takes. The change in our approach using our nursing staff, we hope will provide some relief. We know our nursing staff has been stretched really thin in this pandemic. And many of them are taking the opportunity to go back to school, which we really greatly encourage, and we certainly don't want to discourage that. Not only that, many of them are faced between that rock and a hard spot that I've been talking about now for a couple of weeks, when their kids have to either return to the walls of a school or the virtual community of a school. So we're understanding that too when we are trying to develop our configuration and our organizational structure to be flexible and nimble in responding to these developments. So change is underway. Nothing is etched in stone. We are looking at every opportunity to provide support to the staff and continue support to the community. Testing still remains a very high priority with us. We are very, very reluctant to decrease any of our testing. If our testing doesn't continue in the communities, then we are and will be very alarmed about what could happen as fall approaches and the other respiratory conditions begin to take hold, flu and other things. So testing still remains a mission for which we are greatly adhering to. Uh, Not much going on in the other arenas. You heard me just mention, though, flu. We are very aware that we are not that far away from the flu season. And along with the flu season comes upper respiratory issues, pneumonias, strep throats, and things like that. We are crossing our fingers and our toes. We have ordered new equipment that we hope will be made available uh, around the September timeframe, maybe more like the middle of September. But this new equipment will not only allow us to do more rapid flu and strep testing, but will also have the capacity for coronavirus rapid testing. Nothing promised. but we are anxiously hoping that these orders can be fulfilled. We are at least on the waiting list and have gotten our order in, and are really hoping that this will also give us an additional capacity to deal with more testing, more flu testing, more strep testing. We are very aware of what could lie ahead of us in the flu and winter months. So stay tuned. We are also very aware of the impact the coronavirus has had on immunizations for children, infants and children. And there is a concerted effort that has come forth out of HRSA and out of the National Department of Health and Human Services, and of course our state, around a really push for immunizations. We're very aware of that. We're aware that in this pandemic that many parents have been very reluctant to bring children in for immunizations, vaccines, even well child checks. We have been very successfully, though, conducting many of them in telehealth environments, also in our mobile vans, and we are really going to, over the next several months, be pushing that. You'll see more activity along encouraging for vaccines and immunizations and well child checks. So things are going on. Once again, let me congratulate our work during the Community Health Center week last week. It was a very beautiful week. We are lighting the way indeed. Health centers mean quite a bit to the nation. Across the world and environment of health centers, we have performed 8.3 million tests for the coronavirus. So that is making a substantial impact on how this virus is being addressed. We are indeed making a difference. And as we've said many times, and as our t shirts will remind us, we are Care South Carolina strong. Folks, stay safe over the weekend, stay well, wear your mask, wash your hands, keep a distance, and we'll see you on Monday morning. Bye bye.